Welcome everyone. My name is Dr. Michelle McMahon. I am a family nurse practitioner and I am broadcasting to you here from Spring Arbor University. I would like to talk with you today a little bit about cultivating compassion in your life. As a nurse and as a provider, compassion is an essential part of my job and our job as a community. Compassion is important to nursing as we can kind of ease patients and their family members and their caregivers through difficult times and some challenging times as well. So there are some simple things that we can do to help deepen our compassion towards others. One essential thing is listening. It's important to kind of not speak, to open your ears and actually hear what our patients or our friends or whomever is speaking to us has to say. Sometimes we don't need to come up with a resolution to the problem just because this person just wants to actually be heard. Another tip or tool is to respond to emotions. Sometimes due to events or acute events, people are overly emotional. So listen to what they're saying, hear what they are saying, but also watch them and watch their mannerisms. And you want to be able to respond to their emotions. This can allow them to open up to you a little bit more as well. You would like to have your own support system as a provider, as a family member, as a friend. You want to find ways to relieve your own stress and kind of get those other things out there to other people so that you can live a good life as well. So make sure that you're spending quality time doing the things that you love, spending time with your family, with your friends, with your loved ones, so that you could be a good support system for other people as well. You also want to try to treat the whole person. So when you're talking to someone that's having an issue or concern, you don't want to look at just an acute event. You want to look at all of the different circumstances surrounding it as well. So look at all of those different things. Do they have a unique family dynamic? Where are they in regards to their social system and their community? Where are they in regards to their family? Do they have a support system? Are they struggling? Take all of these things into consideration as well when you are working with a family friend or a family member of a patient. It's also important that you put yourself in their situation mentally. So while you may not have experienced some of these things before, it's important that you try to kind of put yourself in their shoes so that you can better understand what they're going through. Well, that concludes my short elevator speech on compassion. I hope you enjoyed, and I look forward to hearing from you.